Monkeypox is a viral disease, and it's in the family of pox viruses. So it's in that family with variola that causes smallpox, vaccinia, which is the virus that's in the smallpox vaccine, and cowpox. So it's one of these pox viruses. They're DNA viruses. That's fortunate because they mutate much less frequently than the RNA viruses like the one that causes COVID. Symptoms would be fever, muscle aches, headache, and also swollen lymph nodes, which is very different from smallpox. Then when you get the rash, it's a firm pustules that are kind of deep-seated, and then those are what's going to be infectious. And then when those pustules rupture, that material is infectious, and then it scabs over, and they're still infectious. So you should stay in isolation until the scabs fall off and new skin heals underneath the scab, and you're considered infectious till then, up to 21 days. There is treatment. Tecovirimat is a drug that is approved by the FDA for treatment of smallpox, but it's so closely related to monkeypox that the feeling is it would be very effective. There's also 2 vaccines. And the way that smallpox was eradicated, what we call ring vaccination. So you'd have a case, and then you'd vaccinate the contacts. And because the incubation with this disease is somewhere between 7 and 14 days, actually, if you get vaccinated within 2 days, it's 100% prevention of developing disease. Even up to 7 days after the onset of symptoms, you probably can significantly decrease severity. This disease requires really close contact with those lesions. There is some data to suggest it may be respiratory droplets, but it's much, much, much less infectious than COVID. So I don't think this is going to be a major problem. I think it's currently limited to the community of men who have sex with men. And if you're not in that community, you're probably at minimal risk. And plus, we already have treatment with the tecovirimat. So I think we're well positioned to keep this under control.